In our interview segment, Dr. Mohammed Kawu speaks about the measures to curtail the spread of the virus in the nation's capital. Dr. Mohammed Kawu, thank you very much for joining us on Dateline Abuja.
Thank you, Ibrahim.
Let's begin by sharing what your experience has been in the FCT, and I'd like you to begin with facts and figures if you've got any.
Yes, as of today, 26 March 2019, the confirmed cases of COVID-19 in FCT, there are 9 cases, 7 males, 2 females, and unfortunately, we had 1 death.
So how has been the experience tackling this pandemic so far been for your office particularly?
So far, so good. One advantage we have is that it started in Lagos. So our team went to Lagos, especially the case management team from Gwagwarada. They co-managed Lagos cases. They also saw the setting and the arrangement. So as you won't believe, as they came back 2 days after, we had our first 3 cases. You know, we have 3 index cases. They were all diagnosed at this. We got the result at the same time in the night, 3 cases. So we immediately moved them to Gwagwarada, and it was smooth because they had co-managed those cases and they were ready.
The experience they got from Lagos.
The experience they got from Lagos. So that made life much, much easier for us.
Now let's talk about these isolation and management centers that you have in the FCT. I mean, how did you begin? When did you begin, and what do you have on ground at the moment?
Federal government had started getting that center ready, and the building was completed, and they had arranged and equipped 9-bedded treatment center. And so when it came, we already had 9 beds ready. And FCT supported to increase the bed capacity from 10 to 26. Presently at Gwagwarada, we have 26 beds occupied by 9 patients. So we still have some beds which we pray and hope they will not be occupied. But of course, we are ready for any eventuality. Aside from Gwagwarada, we have started making both Karu Hospital and Zoba hospitals. We've started working on them, and very soon they will be on board. And that is easy because we are using the Gwagwarada specialists that are already managing the cases, that have already visited Lagos. And don't forget, we are the capital city, and so NCDC, Nigerian Center for Disease Control headquarters, is here. So they are with us, WHO. So we're all working together to ensure that whatever we put in place is standard.
In terms of standard now, equipment and all, would you compare what you have in Gwagwarada to what it obtains in Lagos?
I can comfortably compare.
I'll come back to this issue of facilities that you have in Gwagwarada. Do you have enough? I'm talking about consumables, protective gears, and all that.
You must have everything preparing for the worst cases. But the ordinary, simple cases, and these are the ones we have here, they are all stable. I talk to them, they are playing around and they recreate with their colleagues. You won't think they are even sick. So we have the suction machines, we have all the oxygen is there. How are you getting me? So we have the basic things that we require. And don't forget, that is a teaching hospital. That's already there. So there are other things that could be moved to those centers if need arises.
A lot of protective clothing and...
Oh, we have more than enough of those. More than enough. NCDC donated, we procured, so we have more than enough. And an important organization requested that we give them what we required. And we passed them to them, and they are hoping to supply us. So we are ready. We are comfortable in terms of things we need to work with.
It would appear to be smooth sailing thus far, but I'd like to know what has been the most difficult task for you at the moment?
The most difficult moment that we have experienced and we are still experiencing is that there's panic. Especially those people that have contact or travel out. If they sneeze, they think corona had come.
But that's a system, isn't it?
And they call you at any time. And so I also receive calls. In fact, I think even our minister, sometimes he calls us in the night that there is a case, so. There were instances I had to go out around 2 o'clock to go and ensure that a patient is seen and tested. It's not every patient that complains that. Sometimes you go and find that it's just something. So we examine the patient and even prescribe, and the patient takes the drugs. The following morning you go to Oga, I'm okay.
Now, such panic is understandable at a period like this, isn't it?
Of course it is.
So what assurance will we be giving the people?
People should calm down, but report, especially those people that have contact. Contact for those people coming from outside, and those that have contacted those that are diagnosed. So they should complain. Let us sort out the ones that we think, because there is a standard protocol. It's not everybody that is tested. Otherwise, you can't test everybody. So we clerk you, and if you fit into the criteria, we now take your sample. If you don't fit, we talk to you, we advise you, we continue to monitor you. Yes, and that's why the standard for the country is self-isolation, monitoring, and report symptoms and signs that may suggest. Then the personnel will come in, and we now take sample, and the result is communicated to. If you are positive, we immediately evacuate you to the treatment center.
The World Health Organization has expressed concern that if this disease, as it is now, gets out of hand in Africa, we may not have the capacity to handle it. What's your assessment?
It's right. If these things get to communities, it's not going to be funny. For now, in FCT and most other states, it doesn't go to the communities. You can imagine the way we live in our communities. How can you tell somebody not to visit somebody? I mean, there is no place to isolate. Here, if you are in Abuja, you have fine house, good AC and all these things. You stay in your house, on your TV. In the communities, how do they isolate themselves? So whatever we are doing, we are trying to ensure that these things don't get to the communities. And the place is right. I know it's scientific. They do their research, they do forecasting before they advise you.
Dr. Kao, we must thank you very much for speaking with us on the program, and we wish you success as you go about this huge task ahead of you.
Thank you, and we are soliciting the media. You are doing very well. So continue to do and inform the people about this disease very well and what they need to do to prevent and protect themselves. Thank you so much.
Thanks a lot for staying with us. We would like to hear from you on some of the measures of the FCT to manage the COVID-19 situation. Please send your views and comments using the email address and Twitter handles on your screen. Also, be sure to share anything happening within your locality with us. You may watch any episode of the program on YouTube. Thank you for watching. I'm Ibrahim Adra. We'll see you next time.